Good evening, friends. I am Dr. Bhavesh Parekh, Head Medical Oncology Department, Selby Hospitals. April month is a head and neck cancer awareness month. Head and neck cancer or any cancer that is in oral cavity, tongue, in the neck, that comprise of so many cancers, various cancers that includes rare cancers like salivary gland tumors also, nasopharyngeal cancer also. The most commonly cancer what we had seen is in India, in Gujarat, is because of tobacco or tobacco related. Is a oral tobacco is very common in Gujarat, and people are chewing tobacco, people are sniffing tobacco, people are smoking, and young people especially, even the females, the labor class females are taking tobacco in a various forms. And because of this tobacco in oral forms as well as in other forms also causes various type of head and neck cancer. And this various type of head and neck cancer mostly detected in an advanced stage. And that advanced stage is ultimately we are treating mostly in stage 3 or stage 4. The stage 3 cancer is ultimately a cancers that will help or that will detect and that will treated by the chemotherapy, radiation therapy, and surgery. Chemotherapy is the now gradually a backbone of all type of head and neck cancer. And all type of head and neck cancer, generally we are treating, especially head and neck cancers, we are treating with a neoadjuvant. By taking a chemotherapy, the tumor will decrease in the size, and then we are able to operate, or even after surgery, we are giving adjuvant radiation therapy or sometimes concurrent chemo radiation. So especially a head and neck cancer that will detect in a little bit advanced stage, that is very common form, mostly 60 to 70% of the patients, and has been treated with neoadjuvant chemo, followed by surgery, followed by radiation therapy or concurrent chemo radiation, give a superb result with a very good response rate, and the overall survival also increase. Now the problem is that if at all it is a recur, the cancer will come back again within a year or more than a year. Even now, latest immunotherapy will help in a much better way. The immunotherapy in head and neck cancer, especially various immunotherapy available in India, and that should be given injectably. Sometimes we are also giving oral metronomic tablet or oral therapy also in a recurrent or advanced metastatic head and neck cancer. Friends, the take-home message or the believe me that even sometimes so-called advanced cancer, if we can operate and if we can give a proper adjuvant treatment, that will definitely help us to prevent the cancer. How to detect? The biopsy should be must. We should do CT scan. Sometimes we are doing MRI as well as we are doing PET CT scan. The tongue cancer, the MRI will be much more helpful compared to other cancers where CT scan will be helpful. Once the CT scan and biopsy done, and once the blood report is good enough, then depend on the patient age, depend on the nutritional status, depend on the comorbid illness. We are giving various type of drugs to prevent the cancer, to decrease the cancer, and to cure the cancer. Overall, message to the society is that we have to quit tobacco in any form. Any form of tobacco is detrimental to our health, to our society, especially when there is a cancer to a young generation, and that young generation will lost because of the cancer, it causes some problem. So overall, we have to go at a very early stage to a different hospitals to consult a proper oncologist, radiation oncologist, medical oncologist, or surgical oncologist. And even once it is cured, once treatment is over, the regular follow-up and regular examination or regular consultation to a specialized doctors. Sometimes the ENT doctor, dentist doctors, as well as the other specialty doctor is also plays a very pivotal role in detecting as well as in the follow-up. Now, good and good prosthesis, good and good your post-operative care, physiotherapy, your feeding, your nutrition, your oral care is also very important in head and neck cancer. I, Dr. Bhavesh Parekh, Head Medical Oncology Department, on this April 2022, being a head and neck cancer awareness month, I will urge young people to do a regular oral examination, quit tobacco, as well as consult if there is a doubt, if there is an ulcer, if non-healing ulcer, if there is a soreness in the throat, if there is a dysphagia, difficulty in deglutition, go to your nearby consultant hospitals, super specialized hospital, and take care and take opinion of medical, surgical, and radiation oncologists. Thank you. Thank you very much.